Hello everyone, my name is T and I am a Psychological Wellbeing Practitioner, also known as PWP for short. So this is a career in psychology and today I will be doing a PowerPoint presentation on this career. So the aims of the session is firstly I will go through a little bit about my journey, how I became a PWP, and then talk about what a PWP is, talk a little bit about the stepped care model, the day-to-day tasks of a PWP. I will then go through the entry requirements that are required in order to become a PWP, the career progressions, and then in the end, I understand you all can't ask me questions, but you can always leave a comment down below on the YouTube video for any questions that you might have, and I'll try my best to answer. So starting off with my journey. So this is a little bit of a layout of my journey. From 2014 to 2016, I did 4 A-levels. My A-levels were in business studies, sociology, psychology, English, literature and language. I then went to university in 2016 and I did a BSc in applied psychology. This was BPS accredited. I then straight away went on to do an MSc in health psychology. I then went on to start a trainee PWP course. So this is when I got onto the PWP route. This was before I actually finished my master's degree, so I applied in May to June 2020 and I was accepted for the role in June 2020. So my master's finished in September 2020 and that's what I mean by I had a job before I actually finished. I became a qualified PWP in June to July 2021. I don't actually remember the exact date, but it was around that time. And I did change my service, so I was a qualified PWP in another service, and then after a year I changed my service, the service I'm actually currently working in right now, and I'm still a PWP in that very service. So this is a little bit about my journey. I know very well that I've actually not included my work experience in this slide. This presentation will just end up being extremely long if I did do that. So I am looking to create another presentation about my work experience alongside my educational history. So I will hope to do that soon. So I appreciate that when a lot of psychology students might hear the term psychological wellbeing practitioner, they might think, what is that? I myself didn't actually know what a PWP or a psychological wellbeing practitioner was until my master's actually. So this slide is just going to explain a bit more about what a PWP is, what are the typical duties of a PWP, and so on. So to start off with, just to say then, psychological wellbeing practitioners are basically trained to assess and support people experiencing common mental health problems, principally anxiety disorders such as panic, generalized anxiety, and depression. So it is not treating patients, but it is more the self-management of their recovery. So I always use the term that we are guiding the patients rather than actually treating them. So we do this using a wide range of low-intensity evidence-based interventions such as behavioural activation, worry management, and so on. So these are actually informed by underlying cognitive behavioural principles. Now, a PWP role was actually originally developed to work within improving access to psychological therapies, also known as IAPT, so IAPT services in England, and this was to provide assessment and low-intensity interventions designed to actually aid clinical improvement and social inclusion through the provision of information and support with everything from physical exercise to medication adherence. You become a trainee PWP by applying for a post of a trainee PWP band 4. A lot of the posts are on NHS or track jobs, but I know there are a few services that actually require you to apply to university. For example, in London, some services expect you to apply directly to UCL, for example, because your training is done with UCL. So all PWPs will have to complete an accredited IAP training course that typically consists of 45 days of academic work, so about 1 day per week, alongside supervised practice in the service over the academic year. So while trainee PWPs are in training, they are also employed by a local IAP service, which will employ you permanently if you pass the training. So if you pass the course with the university, you are eligible to become a qualified PWP. Now, I know some services require you to do another interview for this, but for some, as long as you pass, you automatically sort of get the employment of a qualified PWP. So you will have to check your contracts for this actually specific information. PWPs are actually accredited by the BPS, so British Psychological Society. Training is open to people with a wide range of experiences. Graduates usually take a postgraduate certificate, and those without a degree will actually normally do an equivalent graduate level qualification. So a trainee PWP is band 4, so the estimated, currently estimated salary is £22,549, and then as a qualified PWP you're band 5, so that's 25,655. This is different if you work in London because you get the London weighing. So yes, so I've gone through everything. Some other things to mention is when you are a PWP, you can work in various different environments. So some PWPs work in clinics, some work in GP surgeries, some work in hospitals. So there's not one set venue for you to work. Also, PWPs do work in MDTs, so multidisciplinary teams. So you are normally working alongside nurses, high intensity therapists, senior PWPs, and so on. So that was a quick overview of what a PWP is. Now I'm going to talk about the stepped care model. Stepped care model is basically a delivery model, and PWPs normally operate within a stepped care model at step 1 and step 2. So the low intensity treatments, as you can see there. So PWPs normally operate within a stepped care service delivery model on the principle of offering the least intrusive, most effective treatment in the first instant. So this is after which patients can actually be stepped up to a more intensive treatment if required. So although as a PWP I might assess a patient with low intensity, if I feel that the patient actually needs a high intensity treatment, maybe such as OCD, PTSD, then we are able to step them up to a high intensity therapist. So what is a mental health stepped care model? Well, basically, a stepped care is a system of delivering and monitoring treatment. So the patients receive the most effective, yes, yet the least resource intensive treatment. So that is to make sure basically the least resource intensive treatment is delivered to patients first and are only stepped up if there is a need for intensive or specialist service clinically required. Moving on to talk about what day-to-day tasks might look like for a PWP, then just to go through a few of these. So a day-to-day task might involve, and will probably actually involve, doing some assessments. So this is basically taking patient-centered interviews in a sense. This is to identify what the patient's main problem is, if they are actually suitable for the CBT, or if they require some other treatment like counselling, to identify risks. So you will be carrying out thorough risk assessments alongside treatments or assessments. In a day-to-day task, you might be providing evidence-based psychological interventions. So these are things like providing behavioral activation or BA, worry management, cognitive restructuring, or it might actually be that you are delivering a psychoeducational group. So this is a bit similar to the one-to-one intervention such as behavioral activation, but instead, rather than you delivering it just to one patient at a time, you deliver it to a couple, a few patients. This could be done online or in person. At the moment it is mostly online. And it's not actually just one PWP. Both services that I've worked in, they have always been two PWPs, so myself and someone else alongside me. Or it might be that you have actually given a patient to do computerized CBT, so in that case on a day-to-day you'll just sort of be doing the check-ins with them. On a typical day, it might be that you have to contact the patient's GP, nurse or other agencies. Yes, there are some times, although very rare, that if for example risk occurs in an assessment, then you do actually have to contact crisis. You make sure the patient is safe, you contact them, do a referral to them, or it might be that you have to do a referral to eating disorders. So a typical day might include you contacting these external services. Supervision is another one, so we do tend to have 1 hour of supervision a week at least. This is normally with a senior PWP or with a high intensity therapist. Admin day to day, I tend to do a bit of admin every day. This is just to stop piling for me, because that can be extremely stressful. Attending MDT meetings, this tends to happen about once or twice a week, depending on your service again. So a typical day as a PWP will probably include you attending an MDT meeting. And clinical skills, last one. So this might not be so often. It might be once every other week or once a month. So in my previous service, it was sort of 3.5-4 hours once a month, whereas in my current service, it's sort of 2 hours every other week. So again, it will depend on what service you attend, but a day as a PWP will definitely include clinical skills. So moving on to entry requirements then, what do we actually need to become a trainee PWP? So one thing to remember is, at the moment, keeping the guidelines in mind, you don't actually have to have a degree in psychology to get onto the PWP training program, as they are also offered at level 6 and level 7. However, many psychology graduates do pursue this role after a degree, so that is quite common. Other people who can apply to become a trainee PWP are people from the local community with a wide range of life experience, who will be trained to a graduate level, or maybe graduates of any discipline who can demonstrate that they can meet the academic requirements of the postgraduate level qualification. So I'm talking about the course that you have to do as a trainee PWP. Or people who've got experience of working with people with mental health problems, that can often be desirable, or people who can actually show they've got excellent interpersonal skills. So I'm not following the traditional route at the moment. I'm just going to go with the I guess not so traditional route, and that could be, so people who could be eligible to become trainee PWP could be those who completed a level 6 apprenticeship, because they have been approved, and it is actually a great opportunity for people without a degree to go through that route. Maybe people with useful life experience who would like to make a career change and contribute to the local community. So an apprenticeship is an option, basically. That's what I'm trying to say. It's not just that you have to have an undergraduate or a master's degree. Now, typically, you do need a minimum 2-1 in BSc for some courses, for some services. I have actually come across one service in particular in Southwest where if you don't have a minimum of 2-1, then they would like you to have a master's. And if you don't have either, then they would like you to basically write an essay to show that you will be able to handle basically the pressures of the course that you do alongside being a trainee PWP in the service. Every service works different, and there is no set criteria, I guess, but on a minimum, a 2-1 in psychology or an undergraduate degree is necessary. Like I've already said, people with local community life experience is always great. People who've got experience who have mental health problems, and people who've got interpersonal skills. But there is no actually set criteria where you have to have a master's or you have to have life experience. It's pretty broad, and like I've already said, people who've got apprenticeship, level 6 apprenticeships are also eligible to apply for the trainee PWP role. Moving on then to career progression as a PWP. So I'm sure, you know, everyone wants to progress in their career. For some of you watching this presentation might actually just be looking to become a trainee PWP, which is absolutely fine. But it is always nice to know, well, where can this take me in the next 5 or 10 years? So as a qualified and experienced PWP, you can actually apply for more senior posts at Band 6, Band 7 and Band 8A. With additional management and leadership responsibilities or clinical specialisms. So regular supervision will actually enable you to develop in your role. So some of the opportunities that you've got are becoming a high-intensity therapist at Band 7. So a high-intensity therapist is, like I talked about the stepped care model earlier, this is where they can actually look at patients from moderate to severe depression and anxiety, whereas PWPs we look at mild to moderate depression and anxiety. You can also specialize in long-term health conditions. I've actually recently just specialized in that, done a training. So your service can be looking to actually get you on the extra training as well, and training's always great. You can specialize in perinatal training, work in prisons. You can also work in occupational health, so supporting NHS staff with any mental health problems. Become senior PWP, so actually provide case management and clinical skills in supervision to other PWPs, so this would be Band 6. You could also go into management roles, which would sort of be Band 6 or higher, so team management, recruitment or project management. You can also become clinical advisor, so for example advising networks of healthcare professionals and specialist groups regionally. Can also go into research, undertaking research in the NHS or an academic institution. And some PWPs later do like to train as a counselling psychologist, so you would have to drop out and do a PhD in counselling psychology in order to achieve that. Now, another route is clinical psychology. Some PWPs do drop out and get on to the clinical doctorate. One thing to bear in mind is that from March 2022, you do have to be a PWP, a qualified PWP, for at least 2 years before you can actually apply for the psychology doctorate. And I guess this is to make sure that there is less staff dropout, because a lot of PWPs in the past have actually got onto the psychology doctorate, and I guess it's a way for them to retain staff. But yes, just to bear in mind that if you are a PWP, you're looking to get onto the trainee PWP route and it's mostly for you to become a clinical psychologist, then do remember that you do actually have to be a qualified PWP for 2 years before you're eligible for the funding of the clinical psychology doctorate. So that means 3 years in total, so 1 year of trainee PWP and then 2 years of qualified PWP work. So that's all. I've tried my best to contain this presentation as much as I could. It's still extremely long. I am looking to make more presentations going more in detail about my work experience, more in detail about what a day in the life of a PWP looks like. But these are just some of my ideas. I would also really like to know and get some ideas from yourself. What kind of videos or what kind of presentations will you all will you all want me to do? Is there anything specific that you all want me to touch upon? So do leave a comment, or you can always contact me on my Instagram just to send a message if there's something in particular you're looking for. Just to say then, I do have an Instagram account called Psychological Practitioner, and it would be great if you could show me some support on YouTube. It is my first time doing this, so I hope you all find it very helpful. I'm not very good with the whole tech, but I have given it my best and hope you all find it useful. Thank you.